A lot of talk lately from health leaders about how vaccination and the recent large number of COVID infections could be coming together to help push us out of the pandemic and into the COVID endemic phase. All of this talk of immunity is leaving many of you with questions, and tonight we're tackling one that viewer Tom C sent us. So Tom asked us this: if you've been vaccinated and boosted against Delta but are infected by Omicron, does your immunity increase as a result of that exposure to Omicron? So we went to the infectious disease specialist for Novant Health, Dr. David Priest, for some insight, as well as the CDC. And so the CDC actually just released a report on COVID infection and hospitalization rates in California and New York, and it studied the period of time of the Delta surge. So as Delta was taking over as the prominent variant in those areas, here are the big takeaways we saw. First of all, here, people without vaccination and people without infection immunity had the highest COVID rates. So this group without essentially any immunity against COVID-19 seemed to be the most susceptible. The report also found this, that COVID rates seemed to decrease for vaccinated people who had never had COVID and for unvaccinated people who previously had COVID. But we saw overall the lowest COVID rates were in those who were both vaccinated and had survived a COVID infection. Take a listen.
What we're finding is that individuals who've had COVID, who've also been vaccinated, appear to have more protection from avoiding that reinfection. So that's the group that has the most protection.
And so we wanted to remind you of this. Health leaders say that this isn't a reason to intentionally go out and try to catch COVID-19, since among many reasons, it would be hard to predict exactly how you would fare with this infection. It's essentially taking a gamble you really don't have to. Dr. Priest also saying this: you shouldn't be relying solely on that prior infection immunity, because that might not last very long. So on that note, he does recommend that previously infected people who haven't been vaccinated go ahead and get vaccinated, particularly if it's been longer than 6 months since your COVID infection.